Welcome back to TV5 News at 9. It's time now for Medical Moments with Covenant Healthcare. And joining us this morning, we have Dr. Tessa Dake, Assistant Director of Primary Care at Covenant. Good morning.
Good morning. Thanks for having me.
Of course. Thanks for being here. So, Dr. Dake, just before we get started, share with us a little bit about your role and what you do.
Yeah, so as you mentioned, I'm Dr. Tessa Dake. I'm a family medicine physician in the area, and I'm the Assistant Director of Primary Care for Covenant. So over the last year and a half, I've really focused on making care accessible to patients in our area.
So for someone who has never had a primary care provider or hasn't seen one in a while, why is now the right time to get connected with a doctor?
Yeah, well, that's a great question. And to be honest, we see it all the time. So know if that's you, you're not alone. Between kids, parents, work, loved ones, we all get really, really busy, and it's easy to put your health care on the back burner. So now's a great time to connect. The goal of having a primary care provider is having someone who knows your story and can really help guide you through your care one step at a time.
For sure. And one concern lots of us have is getting in quickly. I'm sure you guys know that all too well. How is your team making sure patients are seen in a timely manner?
Absolutely. So we know access to health care is extremely important, and it's been really hard for patients in the last few years. So at Covenant, we've really made it a top priority. We created Covenant Care Connect. It's a hotline that patients can call and within a few minutes be connected with a primary care provider and be given an appointment, often within a few days.
And going off of that, technology like MyChart has really changed the doctor-patient experience and the way we interact with our healthcare providers. Tell us, how do web portals like these make getting care easier for patients?
Absolutely. MyChart has been transformational. It really puts healthcare in the palm of your hand. You can send your provider a message, you can review your results, you can request a medication refill, or even request an appointment. And so it's about saving patients time and getting them to the care they need as quickly as possible.
And just to wrap up, if someone is watching this and still wondering whether they really need a primary care physician, what would you say to them?
I would say primary care is called primary for a reason. It's foundational to our health. And when it comes to having a provider, the goal is to catch things early, to keep small problems small, but also to walk with patients through every step of their life and be able to have someone in your corner that you can trust when you really need it.
And just a follow-up question, how often should we be checking in with our primary care doctors and scheduling visits?
Yeah, it's highly variable. If you're healthy and don't have a lot of medical concerns, once a year for your physical to make sure we're screening for medical issues early and catching things before they become bigger problems is probably enough. But again, if you have multiple medical concerns, you might be seeing someone 2 or 3 times a year to make sure we stay on top of things for you.
All right. Well, Dr. Dake, thank you so much for being here. We appreciate you.
Absolutely. Thank you for having me. Have a great day.
You can always find more information, too, on today's topic on our website. Just visit our website, WNEM.com, and click on Hot Links. We'll be right back.